Hi, Kathy White, certified professional ergonomist. I'd like to talk to you today in a very introductory way about the concept of psychosocial risk factors and how that can impact your risk of a musculoskeletal disorder. I know a lot of times when we talk about ergonomics, we focus a lot on physical risk factors or aspects of work design that may impact things like force, posture, repetition. But there's another emerging aspect that is starting to be talked about more in our environment around mental health, well-being, and emotional support, and that centers around these psychosocial factors. Psychosocial factors can either exacerbate musculoskeletal disorders, or there's even emerging research that is showing that they may be additional independent risk factors that lead to risk of musculoskeletal disorders. So it's really important to recognize and try to control these factors in the workplace, whether it's you as an individual or you trying to help somebody else. So let's just start with defining what on earth is psychosocial. What does that even mean? What we're really talking about is the emotional value that can lead to either physical or psychological damage to your health and well-being. I'm just going to give you some ideas and examples of what some of those risk factors are. And in subsequent videos, I'd love to talk more about ways to try to control or manage some of those factors to lower your risk, not only of a musculoskeletal disorder, but other aspects of that emotional well-being also. And you could kind of group these in different categories. There's lots of different definitions out there and examples, but I'll just break down 3 basic categories, and subsequent videos can get into these a little bit more. The first one is work demands. How many hours are you being asked to work per day, per week, cumulative, as well as day to day? What are those work rest cycles? What does that look like? Are there some breaks in that activity to get you back to a positive mental state? What about the workplace culture? What kind of demands does that put? It could be positive or negative, putting on yourself and that well-being. And then there's also the management style, which goes along with that culture piece and how that interfaces with the demands that are placed on you and your work. The second category I'll mention is around job control. Are you clear on what you're being asked to do in terms of your responsibilities? That would be job clarity. And if you're lacking that, that can be a psychosocial risk factor. You may also be in a situation where the demands of work are conflicting. You may have competing priorities that you're trying to manage. You may be in a situation where you are not involved in the decision-making processes. So things are basically happening to you and you're confronted with having to react to those decisions that are being made. You also may be in a situation, unfortunately, in some of our climates today, of job insecurity. You're not sure if you're going to have this job from one day to the next. So there's a lot of these factors that can interact with you having a lack of clarity on what's really in your realm of influence with your job. And then finally, the third factor is around social support at work. And sometimes you may have a lot of it. In other cases, you may be lacking that support. The support can come from colleagues, coworkers, direct reports, or it could come from your own leadership. And another aspect related to that is around communication. How well is your management communicating to you, or peer-to-peer communication, communication top-down? Is that occurring? What does that look like? Because that also interacts with that social support as well. As I mentioned in subsequent videos, we'll get into some more details about ways to control some of these psychosocial risk factors, but the first step here is really just to recognize that they are factors and that you should be able to identify those and thus in turn be able to help control and manage those to decrease some of these risks that we're talking about. I look forward to sharing more information with you in some of these subsequent videos. Thanks for listening.